Late last night, we had a confirmation of a presumptive positive here in BC.
It was no surprise to health officials, almost expected. BC's first case of novel coronavirus.
So this person is a male in his 40s and a resident of the Vancouver Coastal Health Region. He regularly travels to China for his work and was in Wuhan City on his most recent trip.
After arriving at the airport, he chose to voluntarily self-isolate and has remained at home since.
He didn't go out because he was concerned, and his family was concerned because he had been traveling to Wuhan City, and so they were monitoring him carefully. And when he had his onset of symptoms, he called ahead and went to a clinic.
The man is well enough that he doesn't need hospitalization. He's at home under quarantine, being watched over by doctors and nurses. Dr. Henry says evidence from cases outside of China shows that you aren't contagious until you start showing symptoms, so passengers from his flight won't be contacted. Official confirmation is still to come from the national lab in Winnipeg. But this is the province's one and only confirmed case so far. Even the rumors have been rampant.
You know, like a few days ago, there's a lot of rumors. It's people in Richmond maybe injected by this virus.
Cases allegedly in Richmond, another one out of Burnaby. Accusations of health officials trying to cover up information.
We are very much open here. We will tell you, as we have today, immediately if we know that somebody is positive for this coronavirus.
In a vacuum, disinformation will flourish.
This UBC professor says the rapidly changing situation and restrictive quarantines in China have stoked fears. Add to that the proliferation of social media.
This is when panic and fears can build up, rumors spread on social media. That can be a sort of cauldron for all of these negative emotions.
Her advice is for health authorities to keep pumping out information that's easily shareable online, and for the public to only trust credible media sources, because misinformation can lead to more damage.
How easily those rumors can lead to discrimination, inappropriate discrimination against people. And I think we need to take all those rumors with a grain of salt and recognize they are just that, rumors.
The best way to protect yourself: wash your hands frequently, cough into your elbows, and use all the precautions you normally would with any flu or cold. Leanne Young, CBC News, Vancouver.